Once it happened and I felt it pop, I went down to the ground. I was like, well, I'm sure it could just be dislocated, you know, so I tried to get back up, and then that's when my whole leg collapsed.
Coming up today, a high school athlete with big dreams suffers a major injury. How a team of specialists helped get him back to sports and a state championship. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. I'm Jessica Lovell. When Gabe Amundarain Anchieta and his family moved from South America to Kansas, he quickly found a home in sports. Football and powerlifting helped him connect with friends and community. But one night, his dreams were put on hold. Gabe suffered a complex knee injury, a torn ACL, MCL, and meniscus. It was a daunting diagnosis, but he refused to give up. Today, just under 10 months after surgery, he is back to competing and winning.
I feel like the United States in general, it's just such a big country. You can just do whatever you want. I mean, there's so many opportunities.
Gabe Anchieta grew up with his family in Peru and Panama, but when he came to the United States a few years ago, he quickly learned the language and a love of high school sports.
Sports helped me bond with people so much that it makes my life better.
It was a long way from South America, but he fit in just right with his new friends and teammates at Edgerton High School in Gardner, Kansas. One game night, as usual, Gabe went all in, playing against Blue Valley, when something went terribly wrong.
Once it happened and I felt it pop, I went down to the ground. I was like, well, I'm sure it could just be dislocated, you know, so I tried to get back up, and then that's when my whole leg collapsed. I'm just like, why did this have to happen, you know, I just want to play football.
Football and his other sport, powerlifting, was on hold for now. In that moment, Gabe experienced 3 major injuries: a severely damaged meniscus, a pulled ligament that needed reattached to the bone, and an ACL that would require a root repair.
As soon as it happened, my coach called my dad.
Gabe was referred to Dr. Paul Schreppel, an orthopedic surgeon with the University of Kansas Health System and the head orthopedic surgeon for the Kansas City Chiefs.
He literally works with professional athletes, and he's coming over here and helping me, you know.
With 3 injuries, Dr. Schreppel told Gabe it was possible to play football and lift again, but it was going to take some time, consistent rehab, and determination. Gabe was on it.
He said we were looking at a year to a year and a half, you know, to looking fit to play football again.
Not only did Gabe recover, it was quick. In just under 10 months, Gabe was back to the sports he loves.
Halfway through it, I'm like, well, kind of got a chance to win it, you know, might as well go for it. And on that last attempt before, you know, I was just thinking, man, long 8 months, all for this, and it just really, you know, made me get that kind of extra edge to win it all. It was amazing.
Gabe won at the state powerlifting championship.
I mean, since the start, you know, I have that chip on my shoulder, and I just want to get back. Right after surgery, I was saying, in December, I'm going to be squatting 400 pounds. I'm going to do it because I believe in myself.
Gabe credits his KU team, Dr. Schreppel, his trainer, and his physical therapist for helping him fulfill his sports dream his family brought him here to find.
That's the mindset that my parents have always given me, you know, and they've persevered through so many things just to give me and my sister a better life.
And we want to turn to our guest this morning. We have with us Dr. Paul Schreppel, Clinical Service Chief, Orthopedic Surgery and Sports Medicine here at the University of Kansas Health System. We already made mention that you're head orthopedic surgeon with the Kansas City Chiefs. So glad to have you. You also took care of my dad the other week, so thank you for that. And you did that because he thinks that he's Gabe's age, so that's what keeps your clinic probably pretty busy.
Alone.
Exactly. That's what keeps you pretty hopping, I guess, these days, taking care of everybody. We're also so glad to be joined by Andy Struble, Gabe's physical therapist from the health system. You played such a critical part of this whole operation, getting Gabe back. Gabe, also so glad to have you here.
Thank you.
Thanks for taking taken time away from school and your team to be here with us. Dr. Schruppel, I want to start with you. It sounds serious, but how serious was Gabe's injury? And how common is it to see it in a teenage athlete?
Yeah, not an insignificant injury. I mean, every ACL is different, but he happened to have a couple concomitant injuries. His high-grade MCL, and he actually had what's called a Stender's lesion, where the MCL not only tears off of the tibia, it actually flips over some of the hamstring tendons. So that makes it particularly challenging and really a necessity to treat surgically. He also had a pretty complex lateral meniscus tear, and so that was another thing that really limited his early post-op recovery, but also something that needed to be repaired.
I mean, is this pretty common with a player like Gabe who just plays hard? Is it just somebody who gets in there and just goes for it? I mean, is this something you're seeing common? And
we see similar injuries commonly in football, yes.
And then what about him re-injuring himself after he gets back to playing?
Yeah, I mean, that risk is never zero, but risk of injury is never zero playing football or any other collision or contact sport. We're very meticulous in how we progress our athletes after surgery. We have a very regimented, phased rehab protocol. Certainly Andy and his colleagues do an exceptional job of kind of adhering to that, and that was one of the strengths for Gabe. I mean, Gabe just kind of took it, he digested the information, and he stuck exactly to the plan and never really deviated. And I think that's a large credit to him and a big part of why he was so successful.
I guess you have to have a good patient, like
Absolutely.
you said, to make this all work.
The whole team has to buy in, the patient, the physical therapist. I mean, these two have the hard part. I get the easy part.
Oh, okay.
Mine takes a couple hours. Theirs takes many months.
Exactly.
So,
you got to stick to the plan. So, Andy, how do you begin this challenge of getting Gabe ready to return to sports?
Yeah, it's a long process. Like Dr. Schruppel mentioned with the concomitant injuries that Gabe had, you start with certain metrics that you're trying to get early. As you go through the process, you have to start identifying those things that Gabe's going to need to get back on the football field. And you start to tailor your rehab process so that you know that he's physically capable of withstanding those forces and those pressures. And so that's how we start to know that he's ready for the on-field activities that he needs.
So what role does strength training play in preventing future injuries once they return to sports?
Oh, it's a huge component of it. The latter half, if not more, of our whole long rehab process with Gabe was almost exclusively strength training. If you don't have a sufficient return of your strength, it leaves you a whole lot more vulnerable to re-injuries. So, with our team and the processes that we've developed with Dr. Schruppel and the other surgeons and our full rehab staff, we really emphasize tracking and identifying the metrics that we want to see from a strength perspective so that we can feel confident that when he's back out on the field, he's ready to go.
Gabe, you were determined to get back to sports as soon as possible. This was like your goal. Just tell us how your knee is feeling today. Is it just
My knee feels
back to
amazing.
business?
Yeah, it feels almost as if nothing ever happened. Sometimes there's some worry, not really worries, but like minor pains. But it feels great, really, and I feel like the team at KU really helped me get back to 100%.
Good to hear. So how has it changed your approach to training since this injury? Anything changed for you?
I mean, at the start, of course, I was, trying to target that leg more to get it back into shape. But now it doesn't really affect my training. I just feels normal, like my leg again.
Andy, parents often worry, when their kid has a knee injury, any type of injury, that they might not get back to that 100%. From your perspective, how do they get close?
Oh, sure. I mean, so many of the types of injuries, particularly knee injuries that we see, it's fully reasonable to expect athletes to get back to 100% of what they have. The other nice part is when we have the athletes like Gabe in the clinic, like Dr. Schruppel mentioned, I get to spend months with Gabe. So the other aspect of it is we get to spend all this time kind of educating these athletes on what are the most, critical aspects, things that they should continue to pursue in the weight room and things like that. So, we fully expect most of our athletes to get back to 100%, if not, come out of this whole rehab process even better than when they got injured originally.
Dr. Schruppel, it was not lost on Gabe that you take care of the Chiefs. So what lessons from pro athletes like the Chiefs carry over into treating high school athletes like Gabe?
Our surgical techniques are very similar across the board. I would say the biggest thing that we can kind of extrapolate from the pro level is our approach to rehab. how aggressive we are. We really try surgically to fix things as well as possible so we can be as aggressive as possible afterwards. And for Gabe, he unfortunately had both the MCL repair and the meniscus repair where we had to be a little bit more cautious early on. But we can be pretty confident as we get through the rehab, and we can take a lot of the lessons we learn at that level and apply them to all of our athletes, amateur and recreational.
Gabe, what was it like working with Dr. Schruppel? Having those conversations with this guy?
I mean, from the moment I came in, it's just, very professional. And like from the start, talking to him, it was clear I wouldn't play football that year, but I felt very safe in his hands, just because how professional of a guy he is and how much experience he has. So I could understand that, it was going to be okay one way or the other.
Yeah, and then you go into Andy's hands, and you both have to have these conversations. Like, these are my goals, right? And so you guys are having these conversations. What were those like? I
mean, from the start, like me and Andy, I felt like just had a connection, and I understood that to get back, I had to do everything possible, and he also understood that I really, really wanted to get back fast. So I feel like just understanding my goals, and I understood his goals, just really made the perfect team. Love that.
All right, be sure to ask your questions. Use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Andy, we know that young athletes can push themselves like Gabe really wanted to, in some cases harder maybe than they should. What advice do you have for athletes about listening to their bodies when recovering and communicating with you?
Oh, yeah, I mean, that's so important. Now, Gabe and I had some hard conversations early on, because the type of rehab that he was doing, it is a little bit slower to start. So a lot of it boils down to identifying the goals early on and telling him how he can push in that respect. Gabe is a strong guy. He likes getting in the weight room. Early on after rehab, that's not the type of stuff that we want him doing. So it's really about identifying your goals. And then when you get further into the rehab process and you can actually start to push, then we kind of let Gabe, off the leash a little bit, let him get after it. And that's when he really started to thrive. It's when he could just kind of sink his teeth into his strength training. And that's probably why we're, doing as well as we did.
Gabe, is that something you struggled with, trying to pace yourself, or did you just stay on track?
Definitely. At the start, it's like, you can't put weight on it. I'm like, oh, that's going to be hard, It's just crutching around for 6 weeks. And then we start weight training, and from the start, I just want to go back to it, going back to the same weights I was doing and everything. But it's very important to pace yourself, because if you don't, then you can end up ruining it for the future, So you just have to take it slow, and even though it's hard to take it slow, you have to.
And that's what Gabe did so well. I mean, he approached it with a level of maturity, because a lot of athletes want to rush back, and there's times during the rehab process where we really put our foot on the gas, and there's other times like that max protect phase in the first 6 weeks, particularly with his combination of injuries, that is not the time to be pushing through and doing things that we're not telling you to do, because we really got to let biology take its course and heal. Well, and he did that.
You said the maturity too. I mean, that's hard to do when you're young and you're something to prove, and you just want to get back and be with your friends and your teammates, and that's not easy. How have surgical techniques, though, for these repairs, the ACL, meniscus repair, how have they advanced just in the last decade?
I think we're always evolving. ACL is the most studied ligament in the body, so we have a lot of literature that guides what we do there. I'd say less has changed there, except for maybe some graft choice options. Probably the meniscus repair part is where we've really progressed in the last decade. We've known how important the meniscus is for a number of decades, but we're pretty limited in some capacity, at least, with the devices that we had. And now with a very complex tear like Gabe had, we have actually a number of tools at our disposal to really repair that. And that's so important for the long-term health or kind of lifelong health of the knee, to try to get a functional, healthy meniscus. So I'd say that's the biggest difference.
Explain exactly those 3 injuries, though, that he suffered. These explain them to me and say them, because they're kind of hard to describe.
Sure.
So I'll let you handle that.
Gabe's whole knee is going to be out there. So
exactly.
He had an ACL rupture. So the cruciate ligament is in the middle of the knee that controls the bottom bone of the tibia from shifting forward and rotating in. He had a lateral meniscus tear, so a complex lateral meniscus tear. So that's one of the C-shaped pieces of cartilage that you have. You have a medial and lateral, so inside and outside. His was on the outside that was torn, so that was the complex tear I was alluding to earlier. And then also had a high-grade or full-thickness MCL tear on the inside part of his knee. So that stabilizes the knee from side to side.
Is it typical for all, when one of those happens, to all three of them happen?
I wouldn't say it's typical. We would love it if it was just the ACL, because we could have been more aggressive early on in his rehab. But sometimes, particularly as the injury mechanism goes, that we call it dynamic valgus, where the knee buckles in, as that becomes more severe, then it causes more trauma to the MCL and then potentially the lateral meniscus as well.
So, Gabe, you hear trauma and severe and these three injuries. Those aren't really words you want to hear. How did you stay positive when you get this diagnosis and know that you've got months of rehab ahead of you?
I mean, since the start, like just hearing those big words get thrown at me, I'm scared, a little unsettled. But, just looking forward and just looking towards the future really helped me stay on track, and my parents, of course, are always staying positive and trying to help me in all the ways that they can. So I feel like them and also my friends, always being there for me and doing everything they can really helped me just, stay on track for the future.
I could tell. Your mom's here with you this morning. You've got a lot of great family, friend, and physical support here surrounding you. And it's really great to see. And you did everything right, because I want to talk about when you won the state powerlifting championship. What went through your mind just knowing I made it to this? I mean, I did everything right, and it's paying off.
Yeah, I mean, in that moment, it's just like I start looking back at when it happened and just thinking about that. In less than a year, I've been able to go that far. Just made me, keep looking forward towards football. And this year, powerlifting, I love just keeping looking forward, because, I mean, you can't do anything to change the past. You can only do so many things to change the present. All you can do is set your sights toward the future.
And you got a lot to look forward to. You just gave some great advice, but what other advice do you have for maybe young athletes who might face a setback?
I mean, definitely, you can't, in the moment, it's hard, but you can't just get down on yourself, because that's the way you struggle with mentally. And mentally, you have to stay in a positive headspace, I'd say, the whole time, because if you get negative, then it's going to start going bad and bad. So yeah, just staying in a positive headspace and always looking towards the future, like I said.
Yeah, when it came to rehab, was it the mental part or the physical part, or a little bit of both?
I'd say for me, definitely it was more the mental part, because physically, I'd say I had all the strength, but just mentally, trying to assure myself that my knee's okay. It's just going through it and the pain. It's just, mental toughness.
Yeah. Andy, what's your process for testing whether an athlete's really ready for a competition like we see here?
Our team, our sports medicine team, has been developing a kind of a battery of tests that we use with all of our athletes, towards those later stages of the rehab process when trying to decide if they're ready. It includes things like strength testings for the quadriceps, the hamstrings, and we compare those numbers to the other side, working on the assumption that their uninjured side is kind of our metric we're trying to get back to. It includes things like jump testing, hop testing, some body mechanics work, all things that have been developed to make sure that they're ready for the demands of what they need. So it's a really robust test. It's a challenging test, as I'm sure Gabe can attest to, but it gives us a lot more confidence in our kind of on-field product.
Couple more questions, Dr. Schruppel, for you before we get to some community ones. How do you determine whether to use a patient's own tissue or a donor graft in ACL reconstruction?
Yeah, great question. Both are options. It just depends on what kind of athlete and what your activity demands are. I would say for him, as a high-level adolescent athlete, I always kind of tell folks, you may read about a cadaver graft online or hear about it from friends. Just throw that out. That is not a suitable graft for you, because the re-tear rate in many studies has been shown to be substantially higher, in fact, multiple-fold higher in a young, high-level athlete like him. Now, if you're me, if you're in your 40s or your 50s and you're a recreational athlete, lower demand, then maybe a cadaver graft or a donor graft would be a more suitable option for you. It's a little bit less post-operative pain. It's a little bit easier to get back to the office and things like that. So for that individual, that may be a suitable graft. For a young athlete, absolutely should be their own tissue. And then it really comes down to a number of variables. Skeletal maturity, so if they have growth plates, sometimes that affects which graft we choose. Demands of the specific sport. So if it's an athlete like a wrestler, for example, that's down on the front of their knee commonly, then maybe the patellar tendon graft that Gabe had may not be as good an option just because it's more irritating to be on that donor side all the time. So a lot of variables play a part in how we decide which graft.
That makes sense. I did not know that. Okay, so last question for you is, what role does imaging, like MRI, CT, play, like when you're guiding the surgical plan?
Yeah, MRI is, obviously the physical exam is the first thing that kind of cues us to what the injury may be. We can assess laxity in certain planes to kind of have an idea that maybe has an ACL, an MCL, things like that. But the MRI, in large part, confirms that MRIs aren't perfect. Mm-hmm. So we always start our surgery with diagnostic arthroscopy. So we take our camera, we kind of tour the entire joint, look at all of those structures just to make sure it is in fact how it looked in the MRI. There's not a meniscal tear, for example, that didn't show up in the MRI. But the MRI is the best study that we have to look at soft tissue injury and at least develop the surgical plan going in.
All right, let's get to some questions from our viewers this morning. I have a comment from Becky. She says, Dr. Streppel is my favorite ortho.
Nice of her to say.
That's a nice one to get going here this morning. Okay, Jeremy just wants to know, and you did touch on it a little bit, Andy, but how do you know when it's safe to start pushing things again? Just in general, is there just something for just maybe even not for big, the big athlete out there, but maybe just for the rest of us?
Yeah, sure. I mean, this comes up a lot early in rehab process. When we're starting to try and push, there's a lot of things we have to monitor. So we're looking at things like, if they're getting increased amounts of pain or swelling after, performing new exercises, it gives you an indication that we're probably not ready for the demands of that exercise yet. Gives us an indication that maybe we need to regress for a little while, allow a little more time for the healing process to go on. So we're looking at pain, swelling, maybe loss of range of motion, simple things like that. And we're looking at those from kind of a day-to-day basis, and on a test-retest kind of method. You do the exercises and you see how your body handles the demands.
Carla wants to know, what's the most important exercise to protect your knees if you play sports? And again, maybe talk to us older people. And I'm older than you.
That's probably a loaded question. There's a lot of good stuff. Really, kind of the cop-out answer is probably what you need is a well-rounded exercise program that includes kind of a combination of isolated strengthening exercises and what we call functional strengthening exercises. So squats and RDLs or deadlifts or something like those. But if you're going to try and get me to boil down to something, the thing that holds us back the most with full release to get back to sports like football, somebody like Gabe, is making sure that they're getting their quadriceps strength back. So the muscle that extends the lower leg out, like you're doing kickouts, is always the one that we seem to fixate on the most and drives most of our rehab decisions.
Robert wants to know, can kids grow out of knee injuries, or do they usually require surgery?
There's a lot of injuries that you can grow out of. It really just kind of depends on what structures are involved.
Yeah, so I would say not as well. Yes, injuries can change from pre-skeletal maturity to post-skeletal maturity. There's also aches and pains, apophysitis, for example, which is, for example, Osgood Slaughters. That's one that's very common in pediatric and kind of pre-adolescent patients until those skeletally mature. That type of thing they do grow out of once their growth plates are closed. But injuries like ACLs are pervasive throughout all age groups.
Lisa is asking, what's the difference between a torn ACL and a sprain? What does it feel like?
So a sprain is a term we use for any degree of ligament tearing.
Everything,
yes.
Yeah.
So
okay.
in all of orthopedics, we seem to have generally 3 types, 3 grades. So 1, 2, and 3. So a full thickness tear is a grade 3 sprain. So in some ways, they're kind of synonymous. Now, it is possible to have a very low grade sprain to the ACL where we may see some fluid in an MRI and it remains intact and functional and doesn't require surgery. But any higher grade sprain or tear to the ACL generally creates some instability that requires surgery.
Sam asks, are there long-term effects of ACL injuries like arthritis later in life?
There are. There are. So a number of injuries, and that's why I was pointing to the importance of meniscal repair earlier, because the meniscus is such an important cushion for the surfaces. Arthritis is the loss of that surface cartilage, and so the less functional meniscus you have, the more stress goes to the surfaces, and thereby creates a higher risk of progressive arthritis down the road. And then any injury such as an ACL tear or a fracture in the joint, those all tend to increase risk of arthritis down the road.
Did you play sports in high school? What did you play?
Football, wrestled, and golf.
Did you get injured a lot?
I actually did okay.
You did?
Yeah. I had a few injuries, but it wasn't actually in sports.
Well, I played 4th, 5th, and 6th grade basketball.
Did you have any injuries?
Oh, yeah, let me tell you. I probably broke a nail. Right? Hardcore 4th and 5th grade. Okay, Gabe, Ellen wants to know, how do you balance school sports and the mental stress of recovering at such a young age? And you're, dealing with just trying to do good in school as well.
Yeah. I mean, definitely, like, starting, it was a little stressful, walking around the hall in crutches and then trying to rehab. But just finding the balance is, so important, because if you can't balance, you can't keep going. So kind of at the start is, focus more on your school than on rehab, because school's always the most important part.
Very smart.
Yeah.
He touched on something too. I
Yeah.
just wanted to elaborate on, Gabe, when you talked about how important the mental side is and mental toughness. And this is a really challenging thing for a youth athlete to go through. I mean, this is a big life-changing event for the better part of a year. And, he's got a mental resilience that is impressive, and not all of us have that, and that's okay. And so I would encourage people to really use the community around them. Lean on your friends, lean on family members, and lean on the team that we have. I mean, we have sports psychologists that can really help from that standpoint. We have nutritionists that can help from the dietary standpoint. We have a whole team, in addition to Andy and his colleagues, that can really help facilitate that and try to support the athlete from all of those avenues to optimize their return.
So glad you brought that up. It's really, really important. And what's your college plans? Do you have anything? What's on the horizon there?
Right now, I'm not sure if I'm going to play football anywhere in college. If I was going to, it'd probably be Pittsburgh State or small D2, But if I don't play football, I'll probably still attend Pittsburgh State,
Yeah, I
just
got
to
some
get a
family at Pittsburgh.
Yeah.
Went to Pitt State. Yeah, great school.
just to get my pre-med. Since my surgery, I've actually kind of looked more into the medical field, and I really like it. It looks like a great career.
It seems to be a pretty decent career. I mean,
Yeah.
it seems
I think he's making an excellent choice.
I think he's making an excellent choice. Less injuries, I think, in the medical field, right?
That's right.
Doesn't
I
seem
knew
to
early
be.
on I wasn't going to make my money being an athlete.
Yeah,
so.
exactly. Smart kid. Okay, I love this. Eddie, what's the big takeaway? What do you want people to really grasp onto today?
The whole takeaway from a process like Gabe's is, if you get hurt and you're, staring down the barrel of one of these long rehab processes, going into it, open eyes, open heart. Gabe here just had the great mental, he wrapped his head around it the whole time. He engaged in the process. He was present every day. He pushed himself. He was a perfect patient. He made my job incredibly easy. But if you go into it with that kind of mind frame, I think that it makes the process a lot more enjoyable. You learn a lot. You come out really strong on the other end, and so it's an overall enjoyable process for everybody, and you get the exact results that you want.
Great. Eddie, you've been a really great guest today. Your insight and your expertise on this topic has been really, really, really nice to hear, so thank you for that. Gabe, what's the big takeaway from your personal story? What do you want us to know?
Just really want, not only my message to get out there, but I just want everyone kind of to just understand that it's not only right now, but what can you do to be better in the future? How can you set yourself up to achieve your goals and your long-term goals, even to, not only do things for right now, but for the future down the road in 10 years and 20 years.
Well, thank you so much for sharing your story.
Thank
We're
you
so
so
glad you're
much for
doing
having
well. Keep it up. Keep it up. All right, Dr. Schrupp will wrap us up on this Friday.
Well, thank you for having us. Gabe, thanks for joining us. Exceptional job in your rehab. I mean, the way you approached everything from beginning to end is why you're where you're at now. And so kudos to you and how you carry yourself and approach these types of things. So
That's
Thank
it?
you.
Thank
That's
you.
it.
What are you doing this weekend? Nothing?
It's bye week.
It's bye week.
Yeah.
All right. So you rest up, okay?
That's right.
Okay. Thanks.
Not working.
Not working. I like that. All right, everyone. Thanks to our panel of guests today. Thanks to our viewers for being with us. Have a great weekend. We'll see you back here on Monday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.